I'm Eileen Joyce, an oncology social worker at Brigham and Women's Faulkner Breast Center. Here, in addition to world-class physicians, state-of-the-art technology, and experts in various fields who help guide you through your physical recovery, you'll also find resources to help you cope with one of the most difficult aspects of cancer diagnosis, the emotional part.
What does a social worker do in a doctor's office?
No one is ever prepared for a cancer diagnosis. Cancer throws life into turmoil when it hits. For some, it's how can I manage work, daily life, and my basic needs. For others, it's how do I cope with the fear, sadness, and anger. As an oncology social worker, I'm a trained mental health professional who specializes in helping patients and families through their cancer experience. Whether it's offering a safe place to explore your concerns and figure out new ways to manage the emotional impacts of cancer, or providing information and guidance with concrete practical advice, I can help you move through and cope with your cancer diagnosis and treatment.
I am so stressed out, anxious, tearful. Is there anything available to help me get through the next steps of my care?
There's a huge amount of anxiety, sadness, and stress that hits you when you hear the word cancer. Waiting for test results, treatment plans, and surgery dates just adds to that anxiety. Many of the people who come to us feel like they're holding their breath for weeks or months on end, wondering what will happen next or what the next test will show. Sometimes having someone to talk to outside of friends and family who are dealing with their own sadness and fear can help you cope with what you're going through, help you problem solve how you will get through the waiting and the fear, and explore and rally your own internal strengths and resources as you move forward. I'm here to help you access new ideas and skills to support you through your cancer care.
Lumpectomy, mastectomy, reconstruction. How do I know what's right for me, and how do I decide what to do?
Obviously, this discussion starts with your physician, who will help you explore the treatment options available to you. Sometimes the decisions and choices are very clear. Other times you're left with choices to make. Healthcare today is much more of a partnership between providers and patients. This can be very empowering. You're given information and, where possible, the opportunity to decide the path that's right for you. But it can also be very scary when you're faced with several options, each having their good and bad. You may be left wondering which is right. The reality is, when your doctor gives you information and choices, there may not be an absolute right or wrong. Rather, you may have to decide what's right for me and what's wrong for me. I can help you sort through your thoughts and feelings, figure out your questions and concerns, and come to understand what is right for you and why.
How do I tell my kids about my cancer?
As parents, we want to protect our children. Some of my patients ask, do I need to tell my kids about my cancer? Others ask, how do I tell my kids about my cancer? I'll help you think through what is best for your kids. Together, we'll consider how to tell them and explore the specific language you might use to help them understand what's going on. I can also help you access other supports and resources for your children as you move through your cancer treatment.
How do I move forward after a cancer diagnosis?
There are more cancer survivors these days than ever before. As we improve our ability to diagnose, treat, manage, and cure cancer, so many people are now exploring the question, what now? As your oncology social worker, I can help you explore this question, learn new ways to cope with the impact cancer has had in your life, and connect with survivorship resources as needed. Remember, you may have cancer, but your cancer doesn't need to define you. I'm here to help you explore what your cancer experience means to you and how it fits into the whole person that you are as you move forward.